Okay, I'm going to first of all say that thank you for inviting me to give this talk. I'm going to try and make it brief because I'm a psychiatrist by profession, and to be able to give a talk on mental health is huge. So maybe very basic, and I hope that you enjoy it. And so can we have the next slide, please? Right, so
apologies, doctor.
I wanted to refer to
doctor, please, can I just ask everybody else to go on mute, please? Please, can everybody go on mute? Apart from the doctor, thank you. Please go on, sir.
Yeah, right. So just wanted to make reference to what health is about. I apologize if you're not a Christian. This is not supposed to be a church presentation, but just wanted to bring us to the knowledge that the Bible itself refers to our health at certain times. In the book of 3 John, first 2, and we're sort of saying to Cares that behold, I wish above all things that you may prosper and be in good health, even as you so prosper. And then in Jeremiah 30:17, Jeremiah was the Lord said to Jeremiah that I will restore you to health and heal your wounds. And so a few times reference to our health was made in the Bible. And I suspect that it's sort of in other religions as well. Next slide, please. So how does the WHO, the World Health Organization, describe our health? So it's a state of complete physical, mental, and social well-being, and not only the absence of disease or infirmity. And I like this caption that says that without, there's no health without mental health, which sort of identifies how important our mental health is. So what is mental health? The definition, according to WHO as well, is the absence is not just only the absence of mental disorder. It's a state of well-being in which our individual realizes their own ability of what they can do without stress, and also be able to make contribution to their community and in their family. And next slide, please. So because we are men of a certain age, I've been asked to, I've sort of made this presentation about men essentially. So I'll be making a lot of reference to men, you know, from the middle age. So in England and Wales, in England actually, there's around 1 in 8 of us that has one common mental health problem or the other. Unfortunately, more than 3 times of men will die by suicide compared to women. And in this population, the most affected are those in the range of 40 to 49. Also, men will report lower levels of life satisfaction than women, according to the government National Wellbeing Survey. In addition, men are less likely to access psychological therapies than women, and only 36% of referrals to the NHS therapies are for men. And men are more likely to go missing, they are more likely to sleep rough, or to be dependent on alcohol or on drugs. So you see that as being a man, you're actually at a disadvantage compared to our female spouse. Can we have the next slide, please? So what are the common mental health conditions? I'm going to briefly just talk about depression, anxiety, some psychosis, psychotic illnesses, substance misuse, dementia, and I'm also going to try and lay some emphasis on quite a worry these days. And then I'll just bring our minds to some neurodevelopmental disorders that most of us may well have heard of or be aware of. Next slide, please. So what is depression? It is actually, and 1 out of 4 people, this is not only about men, but 1 out of 4 people in general will suffer from. So what exactly is it? So most people that have a depression or depressive illness will complain of certain things. So they may describe that they have a low mood, which is a pervasive mood. So it's not good enough to have a mood of a day or two, but it needs to be at least for, that can be associated with loss of sleep, low energy, poor appetite, low motivations, and anhedonia, meaning that you lose enjoyment in life. So things, say for example, you have enjoyed playing golf and or watching football, or actually some other activities that you may like, and you find that you're not able to do that anymore. Usually is associated with anxiety as well. And when people start having 3 particular features of feeling that there is no hope, situation is helpless, they find themselves in a state of perpetual helplessness, then you start to worry. And during this time, people can still have self-harming or thought of actually having morbid thought of sleeping and not waking up, and consequently can start to have. In psychiatry, it's very important that people who are depressed are risk assessed whether they have suicidal thinking or not. Sort of starting in psychiatry, and there was this question, or I was sort of playing in mind whether if you ask somebody whether they have thoughts of dying, whether you actually put that thought in their mind. But actually, you need to ask the question, because most times what we find out is that it becomes a sign of relief that people are actually, thinking about what I'm thinking about. So it's very important that if people are having you ask them about suicidal thoughts. But for men, the presentation can be a bit different. So you could have some people who have lots of irritability, or they are very angry, and they're from 0 to 100. Suddenly they can have an increased loss of control, and they can start taking some risks. Some people may well say that actually that may be a sign of a bipolar illness, but even somebody who is depressed can take some risky behavior. And as I said, they can just become aggressive. So that irritability can be a sign of depression as well. So how do you treat depression? If it's been identified that the person has a depressive episode or a depressive disorder, then most people respond to antidepressant medication. Usually, you would expect that somebody should have psychological therapy, like, for example, cognitive behavioral therapy. NICE guidelines did indicate that it's better to have a psychological treatment first before you use medication. But because of the pressure with NHS these days, it's to get psychological therapy can be challenging. And what we know is that antidepressants cut down the risk of suicide. So it is effective. So unfortunately, some of our men are really loathing to taking medication for their, you want to present as somebody who's macho, but we know that treatment does help. Next slide. Right, so anxiety. So normal response to a stressful situation or to any situation in that matter. So you have a station that you're supposed to respond to it in a normal manner, but your response is quite normal. So it can be irrational at times. So some people can have what we call just thing. It's either that they're worried about some harm coming to themselves or just generally restless. And most times, they feel agitated because of the restlessness. You can have some form of fatigue. They can have difficulty in concentrating, and they can become irritable as well. So irritability can be a sign of depression. It can be also a sign of anxiety. Some of the physical manifestation of anxiety is also things like in what we call palpitation. Your muscles become very tense. You can become breathless. And then some people can have panic attacks, which is sort of a sudden increase in the intensity of anxiety. So another sign of anxiety is avoiding some situations. So some people can have social anxiety, or what we call social phobia, such that they cannot sort of cope in crowded places, or they have difficulty going to new environments, or they have difficulty in making conversation with people that they don't know, or just simple phobia like fear of dogs, fear of lifts. I don't like taking lifts. I need to sort of ensure that there are certain things are put in place to ensure that, okay, this lift is not going to get stuck somewhere. It's not an area where there's going to be this is like irrational sort of fear about that situation. So I can go on and on about anxiety. Anxiety can be very disabling as well. So you could have some people who cannot go to work because of one reason or the other, why they have those sort of issues at work. So how do you some form of non-pharmacological techniques, relaxation, meditation, and things like that? But again, some of the treatment that you use for depression are effective in anxiety as well. So exactly, some medication, antidepressants, can also be used as anxiolytics, say, for example, some of the SSRIs or cognitive behavioral therapy and other psychological intervention can. Next slide, please. Right, so I'm just going to talk briefly about psychosis. Now, this is proper what we call madness. So if people that you see, not this part of the world, but in some part of the world where you can see some people naked and really, really, mad in quotes, they're probably suffering from psychosis. With the reality. So the person has lost touch with reality completely. Have hallucinatory experiences, meaning that they have the perception of things is different from how you and I would perceive things. So for example, here, which we call auditory hallucinations, they can see things that other people cannot see, which we call visual hallucinations. They can start feeling things, like I see they have body or insect crawling on the body when nothing like that is happening, or visceral hallucinations where they can feel part of their intestine or part of their when something like that is not happening. In addition to that, some people can have delusions. As we said, you have an idea which is not based on reality. Paranoid, where they may well have persecutory delusions that somebody maybe is out to kill them or harm them. They could have religious delusions, thinking that maybe they have special messages from God. They can have grandiose delusions, maybe believing that they have special powers or they own Buckingham Palace, or they have very fantastic ideas at times. Psychotic illness it is. The symptoms are different. So, for example, somebody who has what we call a schizophrenic illness or schizophrenia usually have persecutory delusions or paranoid delusions compared to somebody who has a manic psychosis, where they have more grandiose. They have very fantastic, overinflated images or ideas about themselves. So I'm going to come into this, but I just wanted to highlight that in over 50 group, most of our children will probably be in their adolescent years. It's just something to be mindful of. I said I'm going to come back to this, but just to be aware is that there's a change in their personality. Say, for example, somebody who is doing well before in their grades, they're becoming reclusive. They're not interacting the way they used to interact with you. They stay in their room, not coming down. They can become unkempt and then start having unusual behavior. If you start feeling things like that, then you have to then start becoming quite worried. So, what's the treatment? Again, there are very effective antipsychotic medication that you can use in treating psychotic illnesses. Most people that have psychosis also have some form of mood disorder. So at times a mood stabilizer helps. And then psychotherapy, so psychological intervention, for example, cognitive behavioral therapy that is geared towards psychosis, and other therapies as well. Family therapy, individual psychotherapy can be effective as well. Next slide, please. Right, so I'm just going to touch a bit on suicide because this is becoming quite an issue. It's the incidence of suicide seems to be going up due to perhaps sort of many reasons. So what is it? It's an act of intentionally causing one's death. Now we're moving away from people saying that they committed suicide to recognize that people are dying by suicide, because there's a difference. In order to destigmatize suicide, because people are dying by suicide. So it's an act of intentionally causing one's death. So in the United Kingdom, most part of our work is to sort of protect somebody, the sanctity of life. You want to protect people's when they're at risk as much as possible. In other parts of the world, suicide can be a crime. So somebody who attempts to take their own life, if they don't succeed, can go to jail. So in those crimes, well, it's not an advice, but if you try to commit suicide and you don't die, you will. It's a crime. You may be convicted for that. Right. So it's important to have what are the warning signs. So somebody who is excessively sad or low in mood, or they become quite irritable, just of a sudden, it's a warning sign. Somebody who is expressing feelings of hopelessness about the future, is another sign of worry, chronic sleep problems. If there's been a recent circumstances in life, or if they're making preparations, so somebody who's written a suicide letter or unusually keeping their fears in order, or if they're actually threatening or talking about suicide. So we have a lot of patients that will threaten suicide. So you need to take those things seriously because these are warning signs. Next, please. Next slide, please. So what are the common methods of suicide? So what I've done is to look at how people are dying by suicide in the world, and I've put things together rather than actually focusing in the United Kingdom alone. So in some parts of the world, the common method is, and that's by using pesticides. Now, in the United Kingdom, it depends on whether it's a female or a male. Most sort of male will die by suicide by hanging. Most females will die by suicide by ingestion of over-the-counter or prescribed drugs. Right, so the common cause: pesticides, hanging, firearms. So somebody who is a farmer. I remember there was a time many years, about 10, 15 years ago, that was, because most farmers have firearms, they do die by suicide. Suicide has resulted in over 800,000 deaths in 2015, which was an increase of just over 700,000 in 1990. So you can tell by just within 15 years, the number globally had gone exponentially. So this makes suicide the 10th leading cause of death worldwide. So it's a big problem, and that's why it's important to talk about it. Next slide, please. So I've just inserted this slide just to highlight that suicide is not only a problem in the Western world, it's also what happens in developing countries as well. But the statistics and the kind of people that kill themselves, or not the demography of people that kill themselves are different, slightly different depending on where you are. So, say for example, in Nigeria, ages range between 13 and 19. And commonly, it's because of either mental illness or maybe somebody is dependent on substances, for example, alcohol or drugs. And more importantly, there are people born after the 2000. There seems to be an increase in the young people killing themselves. And there's the research is showing that it's probably because there's an increase in single parenthood in that generation. There's the effect of social media on young people. The number of followers they have on a social media handle, and also most importantly, of cyberbullying. So it's very important that there's early identification, and then you preventing things that could happen. Or if there's a mental illness or substance misuse, then people are advised to go for treatment because it can save their lives. Next slide, please. Right, so how about in the United Kingdom? What does the statistic look like? So in 2017, over 6,000 suicides were recorded in Great Britain, and that was, of this, 75% was involved men, which makes it the largest cause of death of people between the ages of 40 and 49 that we talked about. The highest rates are in minority communities, in gay communities, in war veterans, in Black and Asian minority groups, and those of low income. And in terms of the occupation of people that kill themselves, notice that it's people usually of the lowest skilled, and also people in skilled trades. So it's essentially most people in the construction. So what the research saw, the research was saying that in the construction company, in that industry, it's probably because of the long working hours, that they have job uncertainty. People are also walking away from home. They have tight schedules. They have financial pressure, and they kind of the work culture. But most of the skilled work as well. Most of these things, these identify factors that I see in my job, and I suspect that most of you that are listening to this talk today. So these are stressful situations that increases the risk of people dying by suicide. Next slide, please. So I just want to show you a quick video about a young man who sadly took their own life. It's just for about a couple of minutes. Enjoy. Sorry. We can't hear it.
There's no sound from the video.
Oh.
Sorry, did you say there was no sound from the video? Is there sound from the video?
Should there be sound from the video?
There should be sound, yeah.
Yes, there should be sound. Okay, maybe what we'll do, can you hear me?
Yes. Yeah.
Okay, maybe what we'll do is I'll send this video around later. I'll send the link on YouTube. Yes?
All right, okay.
Okay.
Yes, that would be great, thank you. So next slide then. Right, so let's just touch a bit on dementia. This is something that, shouldn't bother us now, just in our 50s, but it could be something that one needs to be aware of. So there are different types. So what is it? Basically, it's just loss of memory. So people who can do things before, now that they've lost their memory. What are different types? There are different types of dementia, but the most common is Alzheimer's dementia and vascular dementia. So what causes it really? It's caused by a damage to the brain cell, which can be due to depression, and I'll come to that. Excessive alcohol intake, thyroid problems, and vitamin deficiencies. Now, the depression would not cause a brain damage, neither would thyroid problems, but some other things could cause a damage to the brain that can lead to what we call a pseudo dementia, or looks like dementia. So somebody who is depressed who are elderly, or somebody who's showing signs of depression, loss of memory, difficulty in planning, not knowing familiar places and all stuff. So losing the memory in short, you have to screen them for some certain things. So you have to rule out a depression. You have to rule out an underactive thyroid, and you have to rule out vitamin, especially vitamin B12 deficiency, because these are things that can be corrected. And if depression is treated, the memory will come back. If the vitamin deficiency is corrected, the memory will come back. And then if you treat the underactive thyroid, the memory will come back. Now, for excessive alcohol, there's something we call Wernicke's Korsakoff and Wernicke's disorder or syndrome, which after somebody has been chronically drinking alcohol can affect the brain and cause brain damage. And usually it's a permanent damage. Yeah, so that is one of the things that alcohol can cause. But in terms of dementia itself, it's basically some chemicals in the brain called amyloid affecting the brain cells, leading to their death. And once it starts, that's it. There's a slow progression, and there isn't really any going back because it's a neurodegenerative disorder. So as I was saying, the symptoms are memory loss, difficulty in planning, not able to recognize familiar places or do familiar tasks, confusion, misplacing things, poor judgment, and decision making. So say, for example, your elderly parents in Africa or in some parts of the world who are supposed to be the ones that are giving decisions or making decisions about your relationships, and you go to them to give you advice, and you're not even aware that they're demented. They can't really make a clear judgment and be able to give you. So one needs to be very, very careful. So unfortunately, there is no cure for dementia. Usually, there can be a way of slowing down the progression with medication and with some, behavioral strategies. And the proper diagnosis can only be made at postmortem, because you can't really, examine the brain that way. So if we just look at the next slide, we'll show what actually goes on in some of the brain. So you can see this is a healthy brain here. So this outer part of the brain is called the cortex, or part of the cerebrum. This part is, you can tell from here and here how different it is. This brain is smaller now. All this part, which is called the white matter of the brain, is really strong. Yeah. So a normal brain has very nice contours of the cortex. The inner bits are called the sulci, and you can see the white matter there. This one is called the ventricle. Now, in somebody who's got Alzheimer's dementia, the ventricles are large that way compared to that one.
Sorry, doctor, are you actually pointing at the
yes, I'm
presentation?
pointing.
Oh, okay.
Oh, all right, okay. What, can you not see my?
No, they can't see you pointing.
All right, okay. Right, okay, I'll just try and explain that. So the normal brain, so I've shown it to you three pictures. The one on the far left shows somebody who's got Alzheimer's dementia. It's a comparison between a healthy brain and the severe Alzheimer's brain. The outer part of that brain is the cortex, and then the grooves, those are the sulci. And then if you go inside slightly, you see the white matter and then the ventricle. Now, if you compare it with the brain of somebody who's got Alzheimer's dementia, you can see how wide the ventricles are, and the white matter have lost volume. And it's just a ragged brain, really. So this is something that you see in postmortem. And then if we compare it to the pictures on these are scans, I believe the MRI scans on the right pictures. These are pictures of somebody who's got vascular dementia. So the picture that says post-stroke, you can see on around the bottom, that's the first picture. Around I was going to say the right lateral part of the brain, there's a whitish thing there. It's quite big. I don't know whether any can.
No, we can see that. We can actually see. Yeah.
So you can, so that's a big impact there. And that means that somebody's had a stroke and there's a big impact, that part that is that different color. The second picture, right in the brain, there's a white thing there as well, just tiny. That's another impact. Yeah. And then the third picture, you can see different white bits inside the brain. So we have multiple impacts there. And then the fourth one, there's lots of impact in the white matter. So this is a picture that you see in somebody who has had a stroke before and likely to have a vascular dementia, because the vessels, or what is showing in vascular dementia, there is an impact or some form of clot has gone into the brain, and that's what's causing dementia. Right, next slide, please. Right, so I'm just going to, these are slightly old slides, but I tried to update them just about COVID-19 and eventually the impact of what it has on mental health. We all know about COVID-19, it was a coronavirus disease that was picked up in 2019 in Wuhan, China. It's an infection caused by new coronavirus. There were other coronaviruses, the MERS coronavirus, which was first discovered in the Middle East, which is a Middle East respiratory syndrome virus. And you have a SARS, severe acute respiratory syndrome. So these were the two coronaviruses before this main one came into play. So what we knew about COVID-19 was most people infected with COVID-19 will experience mild to moderate respiratory illness, and they will recover without treatment. Older people and those with underlying medical problems like cardiovascular diseases, diabetes, chronic respiratory diseases, cancers are more likely to develop serious illnesses. We knew that all regions, all countries were affected. The variability was, the severity was variable in different types of country, and adults were more affected than children. So we knew all that. Next slide, please. Right, we knew that it took about 6 to 5 days for somebody who's infected to start showing symptoms, and it could take up to between 10 to 14 days. And the most common symptoms is fever, dry cough, and tiredness. Serious symptoms include difficulty in breathing, shortness of breath, chest pain, loss of speech or movement, and less common symptoms were, sore throat, diarrhea, conjunctivitis. I remember this conjunctivitis that it was something that one of my colleagues actually, that was what he had. He just had conjunctivitis, and all his family had the same thing. So they were not sure. They had a bit of respiratory problem, but they were not sure. But they did isolate. That was during the very first wave, and then later on, they've added that loss of smell and loss of taste were quite significant as well. But in children, it was more of a rash on the skin or discoloration of the fingers or toes. Next slide, please. Right. Right. So what is it that one has to do? It's mainly about prevention. So there was no cure, or there's still no cure, or universally agreed treatment, but we know that vaccine saves lives. So I'm going to advise, if you haven't been got your vaccine, please do get your vaccine and get your booster dose as well. It can save your life. We've had quite a lot of people, either close or that we knew of, who died of COVID. I've had some of my patients' parents who were passed on, and the impact on the family has been devastating. So the guidelines, washing your hands, social distancing, whether that's going to come back or not, we're not sure. In some parts, go to some of the shops, they're now sort of taking back to sort of social distancing. In some parts, now we have to wear masks if you're going to shops, and in some going to some public places. I mean, certainly if you're within the NHS property, you couldn't enter any of the wards without wearing a mask. It's advised to avoid touching your face, your mouth, and nose. You should try and sort of cover them when you're sneezing. And if you're well, please do not go to hospital. Just stay at home, and then get your lateral flow test, or book yourself in for a test, and do not go to your GP. Right, and next slide, please. Right, I saw this sort of picture just around the first wave, and I thought it was quite interesting because at the time when COVID really hit, nobody knew what was going on, and the CEO of Alibaba did say at the time that it's not about making investment or sort of planning for the future. It's just to stay alive. If you see 2020, then you've actually gained a lot, and I thought it was quite telling. So, because I'm talking to you today, I congratulate you for seeing through 2020. Things seem to be better, but now that Omicron has come, we don't know how that's going to impact. But hopefully, it will. My feeling is that it'll probably die very quickly the way it came, because it seems as though the symptoms are mild, but we just do not know. So it's too early to make any kind of guess. But you can see what happened around the whole world, that they lost in lockdown coming in different parts of the world now. Right. So how has COVID impacted on mental health? And this is the Office of National Statistics study that was published in April 20 this year. So it's showing that actually in adults, over 30% of people have described an increase in psychological distress. And in adults over the age of 52, there has been an increase of depression from 12.5% to almost 29% in December of last year. Again, the prevalence of anxiety has increased quite significantly as well between July of last year and December of this year. And what we also know is that young people are disproportionately affected. They're describing, especially during the lockdown, after the lockdown, an increase in self-harming behavior. We're reporting increase in suicidal thoughts. I have seen an increase in acuity and morbidity among young people. And certainly, unfortunately, there has been an increase in suicide. And this is anecdotal evidence. There hasn't been much of a research onto what the impact of COVID has had on suicide. But from my practice, unfortunately, we've had quite a few young people, I think about 4 this year, who have taken their lives already, which is quite sad indeed. And then it was also showing that there has been an increase in domestic violence. So you can imagine people just locked down in a house, they can't go anywhere, and there's been an increase. Right, next slide, please. Yes, so I just wanted to bring to your attention some important issues. Bearing in mind that we're men of over 50, wanted to bring to your attention some things that you should be aware of. So there are issues with neurodevelopmental disorders in children and in adolescents. And I'll sort of just lay emphasis on if you heard of people who have maybe features of autism spectrum disorder or Asperger's syndrome. That is a condition that is now becoming quite prevalent, and even amongst ethnic minorities, where you have some young people and adolescents who, interpret the world in a very different manner. Then again, it's also for you to be aware that some children do have ADHD features, that's attention deficit hyperactivity disorder. So they have difficulty in their attention, they have difficulty in concentrating, they're hyperactive, they're fidgety, they can't sit still, and it affects their education. Incidentally, ADHD is treatable. The medications are effective, and if you treat the ADHD, the child education will not suffer. So it's not something to sweep under the carpet. If you notice something is unusual, please do speak to somebody about it. The next thing I was going to make to your attention is about adolescents who have a change in their personality. And I alluded to this in one of my slides about the prodrome of a psychotic presentation. So in adolescents, say, for example, maybe by the time they start getting to the age of 18, 19, about the time where they want to enter university, that's when, somebody who may have a prodrome of psychotic illness will start presenting. So if you notice all the change in personality, they're unkempt, they don't want to wash, they're unusual in behavior, alarm bells should start ringing, but there must be something going on. Substance misuse, it's a problem, it's real, it occurs in most universities, it is rife. Make sure you try and educate your children about it. It's not something to not talk about. I think it's important to let them know that, well, you were students before and these things are common, and how you can also help them in them sort of talking about these things. Now, the other thing I want to talk about is emotional dysregulation. And that's what we call it now, because we have a lot of young people, especially in some girls, who present with low mood, and they're self-harming, their emotions are all over the place, they can't balance, they can't control their mood. And we could say things like, the way to cope is to self-harm, and they cut themselves. So just something to be aware of as well. In terms of safety planning, I think that we need to recognize where we are. Young people do not tend to speak to their parents because they just don't think that you understand. You don't know, you're not in their world, you couldn't understand. Please, if you have medications that you're using, and I'm not suggesting that maybe your children are intending to take their lives, but lock them away. I've been saying the same thing to my wife. She hasn't actually listened yet, but because I see a lot of young people who all of a sudden they just take too many tablets. Where they get the tablet, it was just in the cabinet. and you don't know what's going in their mind, if you don't even know that they've been feeling quite low in mood and they have suicidal thoughts, and the first thing they do is just go into their cabinet, take as many tablets as possible. So lock everything away so that at least you're preventing things that, you know, could happen. And I'm not saying that it is going to happen. Then I put issues about social services and safeguarding issues. We have had some requests about assessing families because maybe there have been some form of an allegation of physical assault or chastisement with the children, and social services become involved and issues like that. You know, the way the parenting in the United Kingdom and this part of the world could be different from in other parts of the world. So something just to be, for you to be aware that, you know, any child who sort of allege that somebody, either that's about physical abuse, emotional, any other kind of abuse, can involve the intervention by social services. Next slide, please. Right, so this is the last few bits. How do you actually look after your mental health? I think they're just very basic things without talking about medication and anything. So it's just talk about your feelings. Just if you have things in your mind, find one person or member of family that you're gonna talk to. It's, you know, is a problem shared. It's actually solved. You know, it's very important to talk about the way we feel. We know that we're men. We tend not to do these things, but please, you know, find somebody that you can disclose how you feel. And then, you know, the second thing is just to keep active. Exercise is very important. You know, it releases endorphins and chemicals in the brain that makes you feel, can make you feel good. So if it's only a brisk walk, make it regular. It improves your concentration and your self-esteem and makes you feel better. Then eat well. You know, 3 meals a day. I am one of those that don't stick to this. You know, try just eat only once because, you know what. But, you know, eat a balanced diet, lots of fruits, some nuts, and lots of water as well. And avoid anything that has a lot of sugar or alcohol. And the fourth thing is just keep in touch with, you know, family. They say is everything. The important things in life will now become the associations that you make, the people that you have strong links with, friendship, your social setting, and that's why I'm quite excited about this kind of group. And bring people together. It's very fresh and very good.
Doctor. Hello, doctor.
Yes.
Yeah, we are actually over time in terms of, thank you very much.
Okay.
And just to make sure that people don't run away and have 5 or so minutes to just talk to you.
Okay. Yes.
So should we stop the presentation here so that people can just have a quick chat?
Yeah, no problem, because I think it's only 2 slides more, isn't it? So
yes,
yeah,
there is. Okay, then let me just stop. Well, let me stop recording first of all.